so pleased to have two fabulous speakers with us today. We have Myra Schatzki. She is a speech pathologist and a faculty member at Shenandoah University. And we have Brett Myers, who is a speech language pathologist and faculty member at the University of Utah. Both universities are offering Speak Out in the state of Virginia for free, which we were very excited about. And we're also very pleased that the University of Utah is also offering Speak Out to those who reside in D.C., which I think is wonderful for the folks who are living in the District of Columbia to have that resource. So with that, I'm going to ask Myra and Brett to unmute themselves. I'm going to mute everybody else so we can hear the presentation. And as I mentioned earlier, we will be monitoring questions in the chat. So you're welcome to put your question in the chat for Brett and Myra. And thank you so much, both of you, for being here today.
Thank you for having us.
Thank you.
Really excited. So I'm going to I'll be the first presenter here. Brett and I will be trading off because this is a pretty extensive presentation. So what I'd like to start off with is kind of give you all a little bit of a background of Dr. James Parkinson. And by the way, this presentation was created by Samantha from the Parkinson's Voice Project, and we adapted it and made it more current. So Dr. James Parkinson wrote an essay back in 1817, and he's an English physician and found some of his patients to have these tremors or this shaking, and he wrote this essay on this shaking palsy is what he called it. And he was the first to medically describe this condition. Next slide. Thank you. So in his essay, he defines the shaking palsy as something that's so slight and nearly imperceptible are the first inroads of this malady, and so extremely slow is its progress, that it rarely happens and that the patient can form any recollection of the precise period of its commencement. So understanding when it occurred was not something that was common back then. Next slide. So some of the early symptoms of Parkinson's, there were tremor in one extremity, some shoulder pain, foot cramping, constipation, sleep disturbances, and reduced writing size. So these were kind of just some of these little symptoms. And, you know, when you think about it, the shoulder pain, the foot cramping, I get those. And is it Parkinson's? Well, we will talk more about how Parkinson's became a little more well-defined. Next slide. So April is Parkinson's Awareness Month. World Parkinson's Day is April 11th, and that's James Parkinson's birthday. And they have a flower that they use as a symbol of Parkinson's, and that's a tulip. Then in trying to remember which time period this is, but Dr. Jean-Martin Charcot, he's this French neurologist. He looked at some of Dr. Parkinson's work and then needed to find a way to differentiate it from other disorders like MS. And he suggested that they change the name to Parkinson's disease rather than keeping it as the shaking palsy, so which is a good thing. And because he found that not all patients with Parkinson's disease had tremors. So and not all Parkinson's patients were weak. Next slide. So Parkinson's is characterized by amplitude of movement, so smaller walking, smaller writing, smaller voice, and that the muscles actually become weak because they're not used to their full capacity, not because Parkinson's is making them weak. So those smaller movements affect the use of that full capacity of those muscles. So he narrowed down some of the symptoms to have these 4 cardinal symptoms: the resting tremor, the slowness of movement, impaired balance, and some rigidity or stiffness.
Okay, now I can
And
jump
how
in.
it's okay, great. Thanks, Brett.
Oh, wait, sorry. Is this
No,
still?
no, you're right. That's you.
Okay. Well, so how does Parkinson's get diagnosed today? So when someone goes to their doctor, they will have a thorough case history, trying to pinpoint all of those movement issues that the person is experiencing, try to describe those in detail. They will likely do a neurological exam. They may do CT, MRI, blood tests to rule out other disorders that might be similar to Parkinson's. Um, they will think about those cardinal symptoms that were on the previous slide, and if 2 of them exist in the person, then that is a fairly good sign that they may have Parkinson's. They may try them out on some PD medications, and if there's a positive response, then that may indicate that it may confirm that this is Parkinson's. And they could also do a DAT scan. This is what a DAT scan looks like, and it measures the levels of dopamine in the brain. So you can see on the left brain scan, these 2 hot spots are larger. That's a normal amount of dopamine in the brain. And then on the right side, there's an abnormal amount of dopamine. So the dopamine has reduced over here. So this is where we might suspect that the person has Parkinson's. So that leads us to the question of what causes Parkinson's, and it all generally comes back to that idea of reduced dopamine. By the time that motor symptoms appear in someone with Parkinson's, 80% of the dopamine producing cells are gone. They have died or become impaired. So dopamine is a neurotransmitter that transmits impulses from one neuron to the next for the planning and controlling of automatic muscle movements. So without the appropriate amount of dopamine, automatic movements are disrupted. So here are just a schematic of 2 neurons communicating. And when one neuron comes up and starts talking to another neuron, there's this space in between called the synaptic gap. In that synaptic gap, dopamine is released and helps to transmit information from one neuron to the next. So with less dopamine, those automatic movements are disrupted. But let's talk about what some of those movements are. Yeah. So these are all things that we do automatically: walking, talking, swallowing, blinking, swinging arms while walking, getting out of a chair, picking up a fork. These are things that maybe someone without Parkinson's will do without even thinking about it, right? Speech is another highly automatic behavior. It's something we do without thinking about it. Um, and because it's automatic, people with Parkinson's often have some speech problems that arise. In fact, 90% of individuals with PD are likely to develop speech disorders at some point. Um, and going along with that, when we think about swallowing, aspiration pneumonia is the most common cause of death in PD and accounts for 70% of the mortality rate. So, we can think about speech as automatic. Swallowing is also very automatic. I mean, we swallow hundreds of times a day without even thinking about it. So when we swallow, we want to make sure that we're sending our uh, our food, liquid, secretions down the right pipe and not going into the lungs, which can lead to aspiration pneumonia. So with speech, speech is a motor behavior. So some of the symptoms that we see um, in speech disorders are reduced volume in the voice, a hoarse sounding vocal quality, frequent throat clearing, trailing off at the ends of sentences, and inconsistent production of the voice. So when these things start to happen, they may be a sign of the speech disorder coming on. So, Myra, did you want to talk about the next?
Yes. So when Brett brought up swallowing and why that's so important, and it's kind of in our wheelhouse. The muscles of speech are also the same muscles that we use for swallowing. And so when those muscles we're working on speech, we're also strengthening those muscles for swallowing. And Speak Out program gives us some tools to help with swallowing skills as well. So we want to show some videos, some pre and post treatment videos, and this is one of Jackie. Oh, were you able to get that
Yes.
video?
Tell me if you can hear this sound. No?
Hear the
No,
sound.
yeah, no sound, Brett.
Okay, 1 second.
There's a way to share the sound.
Okay, trying again.
Got it.
Jacqueline Ann Sprower. Jacqueline Ann Sprower. I can lose my voice, yeah.
Okay. What else have you noticed?
As far as voice is concerned?
Yes.
Nothing really, unless my husband can remember something I can't.
Okay. Has anyone said anything to you about your voice?
Well, sometimes my daughter will say, clear your throat, or my husband will say, clear your throat. When the sunlight strikes raindrops in the air, they act like a prism and form a rainbow. The rainbow is a division of white light into many beautiful colors. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. I've noticed that I speak with clarity and I articulate better and I speak with intent.
So I don't know if you all heard the difference and heard some of that hoarseness and gravelly voice that she had prior to using the techniques of Speak Out, using intent. And the difference in quality of both of those voices were were significant. So now I want to talk about just the early signs of swallowing. There's some drooling that occurs, and some of this is inadvertent. We're not really and unconscious. Some are not aware that the drooling is occurring. Coughing soon or during, after eating or drinking. Sometimes pills can get stuck in the throat, the back of the tongue. And then there's also some unexplained weight loss. But here is some good news, is that we have two motor systems in our body, in our brain. Go to the next slide. They're called the extrapyramidal and then the pyramidal system. And we're going to show you the schematic of kind of a sagittal cut of the brain, where the extrapyramidal system shows the system that we use for automatic movement. And the substantia nigra down at the bottom, those little purple kidney-like structures, that's where the dopamine is released. And with the automatic system, our cortex gets the signal and sends all this information down to our neurotransmitters, and the substantia nigra releases the dopamine, and then it goes through all of these different pathways. But when we use our intentional system, we're actually using what we call the pyramidal system. And when we do this, the pathways are not as complex. The information still gets through, but when we're more intentional with our movements, we are kind of going around the substantia nigra and not really imposing the substantia nigra to utilize a lot of that dopamine to have our neurotransmitters talk, or our neurons talk to each other. So that's why there's a lot more fluid movement that goes on with the using intent or more deliberate movement through this pyramidal system. And then there are some examples, of using intent. If you were younger and looking for a job, some of the functional purposes of using intent is people can use it during their job interview, driving also with intent can be helpful, exercising, basketball, all of these physical activities you could do with intent. So let's go to the next slide. So what is automatic versus intentional speech? Let's go through this next video.
Started as good times and I think many efforts, many times.
Deep breath.
She gets right here, but it was good at mine. It's much stronger, much clearer. The words are more concise. I sound like a human being.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15.
My wife has noticed it more than I, but apparently I've lost a lot of oomph in my voice.
Only as part of this process did I learn that I had relinquished control of my voice and relinquished a significant part of my life, which is being sociable and social, and now I think I'm back in charge, or I'm on my way to being back in charge.
It's much softer and more difficult to speak. I speak louder, clearer, and with intent.
Okay. And there's a pretty well-renowned speech language pathologist researcher, Daniel Boone. He was at University of Arizona for a while, but I believe he also was in Ohio at one point, in Cleveland. So he did this interesting finding where in the 1950s, he had people talk or count forward, counting 1 to 10, 1 to 20, and then he had them count backwards. And because counting backwards requires a little bit more thought, there was more of an intentional way of counting, and discovered a clarity in their improved articulation. So that was really interesting that he discovered that. But it wasn't until later where Samantha came up with Speak Out. So the Parkinson's Voice Project program, which is what Brett and I do, are trained to do, are licensed to do. We teach individuals how to use their speech from an automatic, using their automatic system into their more intentional system by using this strategy of speaking with intent. We are now utilizing less dopamine and making sure that we are tapping into that pyramidal system, that neuropathway. And then Samantha also had discovered some other use of intent, like walking and writing, in addition to speaking with intent. It's much more focused, and you have to be more purposeful, and you really have to concentrate, rather than when we're using our extrapyramidal system. So being more deliberate takes much more effort in this. So we have a video here with a couple of gentlemen walking with intent. Yeah, they don't have their beautiful music. So the gait gets a little bit wider when walking with intent. So the movement is much larger. And with those larger movements, they can get to their destination faster. Okay, Brett.
Yeah, so Parkinson's is a movement disorder, but we can battle it by moving. Dopamine, obviously affects our movements, but it also is responsible for motivation and drive. And without enough dopamine, motivation can be a challenge for those with Parkinson's. But again, we can battle that by staying active. The more active we are intentionally, the more motivation and drive we have. It's this sort of vicious circle, or not a vicious circle. It's a great circle to be in. So we want to find ways to stay active and motivate ourselves to exercise daily. So people with a PD may want to set a routine to do that, join a gym or an exercise group or program, exercise with a friend, even if it's just going for a walk every day, and attend a speak out group. So we'll talk about the speak out groups next. So the speak out program is facilitated by a speak out provider like Myra and myself. In the group, we have weekly practice for speak out exercises. It's also a time for people with PD to come together and have peer support and encouragement. It provides accountability and motivation to regularly complete speak out exercises. And this is what the treatment plan sort of looks like in Speak Out. Over on the left, we first have an initial evaluation where you'll sit down with a speech pathologist, and this could be in person or on Zoom like we're doing right now. And then we'll get you into treatment. And treatment will be one-on-one between you and the speech pathologist. And then we'll do that for a few weeks. And then after your one-on-one treatment, then you'll join the group where you can practice with other folks who have, quote unquote, graduated from the one-on-one treatment. But the thing with Speak Out is you never really graduate because it's something you want to keep doing forever. Just like staying active every day, you want to be practicing Speak Out exercises every day. So we'll do those weekly group sessions, each week. But then every 3 to 6 months, we'll have a refresher where it's another one-on-one session between you and the speech pathologist, and we can just sit down and check in to see how things are going. Parkinson Voice Project also has a lecture series online. So if you're interested in learning more about Parkinson's and how it affects speech, you can go to their website and watch some of these lectures that are being presented by Parkinson's experts around the country. There's also a video on their website. It's actually called "What is Parkinson's?" Instead of Parkinson's information session. It's called "What is Parkinson's?" and it's about 25 minutes, but it's a great video to watch with a family member. So you can kind of learn together about, what Parkinson's is and how it affects speech. This is the Speak Out Circle of Intent. This was designed by the Parkinson Voice Project, but it's just they decided to form it into a circle to show that it never ends. Once we're in Speak Out, we're just always in it because we always need to be staying active and practicing. So this just goes through essentially what I presented earlier, but in a circle format. So now Myra and I can tell you about our programs, and we do have a few differences, but we still do, Speak Out, and you're still going to get great treatment at both of our sites. So I'm at the University of Utah, and you might think, why am I here in Virginia with you today? And it's because we are a Speak Out Therapy and Research Center in Utah. And earlier this year, we committed to providing free services to people in Virginia and D.C. So we are sort of extending our services out east. I'm actually from Maryland, so I love that part of the world, and I'll be going back there in a couple weeks to visit family anyway. So we are offering services to you. We like to do 2 sessions a week, and we go for 4 weeks. So you get 8 sessions of one-on-one therapy over 4 weeks. Then you move into the weekly Speak Out group. And Myra, do you want to talk about your program?
Yes. Ours is has a different variation. We do 10-week rotations where we do one-on-one, but our program is a university clinical training program. So our graduate students train our clients under our supervision, under the Speak Out licensed person or therapist. And we provide them with feedback and their skills. But the students are also learning about the Speak Out program. They had to go through the Speak Out training that I went through in order for them to be qualified to provide this service. And then after the 10 weeks, we do move them into a group setting, and it will be a perpetual group that we will offer weekly forever. This is our first semester that we're offering it, so it is not as large yet. We don't actually, this first 10 clients that we're seeing are going to create our first group. Since our program just started this fall, we got our accreditation in May. So I wanted to make sure that Speak Out was part of the students' clinical education. So this is the similarities of our program. In addition to the group, in addition to even during the individual sessions, we ask that our clients exercise twice daily using the Speak Out workbook, and you also have access to the e-library. Once you go through the assessment component, we will give your name to Parkinson's Voice Project, and they send out this information free of charge. So you will get the workbook in your mailbox if you want a hard copy, or if you're just interested in the e-library, but you can get both. And then there are cognitive exercises in there. And we go through those with you, so you're not doing them alone. We will review all of those exercises together, and practicing how to speak with intent, because it is a different way of speaking. You're not accessing that automatic component, that automaticness of speaking out your thoughts, because when you're speaking with intent, you have to be more mindful of utilizing that strategy.
And I'll also just chime in that the University of Utah is also a clinical training program for graduate students. So our clients also work with graduate students under the supervision of a certified SLP. So we have a lot of similarities between us. Of course, another difference is that at the University of Utah, our services would have to be virtual. So we would have to do Zoom sessions for people in Virginia and D.C. And then, Myra, are you doing both in person and virtual?
Yes, we are doing both in person and virtual.
Great.
Yeah. So if you are in Northern Virginia, locally, our campus is located in Leesburg. Just right by, if you're familiar with this area, we are close to the Inova Hospital, just around the corner from them.
So here's our contact information. I'm on the left, Myra's on the right. We have our emails posted here, so feel free to email us if you have any questions about our programs, but we'll also have time for questions here in a minute. Here's a nice little motivational quote: live less out of habit and more out of intent. That's what we're all about in Speak Out. So now we can open it up for questions if anyone has any.
Great. Well, thank you, Brent and Myra. Oh my gosh, so much information and just incredible opportunity that residents in Virginia and DC, and also to mention, if you're not in those states and you're joining us from another state, the Voice Project does have a complete listing of its centers on the website as well. So don't feel like you're left out. and you can always call the Voice Project directly too. They will help you if you're looking for someone and can't seem to find one in your area. They will support you with that as well. So thank you both. I'm going to encourage everybody to unmute themselves. And if you do have a question, we don't have any in the chat yet, Brett and Myra. So we'll see if anybody. Carl?
I have a question.
All right, go ahead.
D.C. and Virginia are two large areas to cover. How prepared are you for an inundation of people?
So our program is, we do have people on the wait list, but we go through the program pretty quickly. Is that what you're asking? How far?
Yes, yeah.
Yeah. And so right now, because we're a brand new program, we only have 10 students, we are going to increase that come fall of 2025. So right now we're taking 10 clients at a time, and I might increase that to 20, depending on how quickly the students are demonstrating competency in providing the service.
In Utah,
a larger group.
Yeah, we have a rather large graduate program. So there's 45 students in each class, which is pretty big for speech pathology programs. And I want all of our students to have experience working with Parkinson's. So we have committed to the Parkinson Voice Project to see 75 new patients a year. So I am, excited to see that many and possibly more. So I think we'll hit those numbers covering 3 state areas.
Great.
First questions in the chat. Can you give an example of one of the voice exercises, please?
Well, the first one that I think a lot of people think of when they think about Speak Out is May, me, my, mo, moo. And I'm doing it the way Samantha Ellendary does it on her videos. You lift the voice up and out for each one, each syllable that you say. And if you want the full package, just to see what it looks like, I encourage you to look at the Parkinson Voice Project website and watch the daily online practice videos, because Samantha goes through all the exercises every day, and it's a great way to see what it looks like. Now, I wouldn't say just go ahead and do those every day without doing the program first, because you'll want to get connected with an SLP to make sure you're doing the exercises correctly. But then those daily videos are really helpful to get people exercising daily.
Yeah, Samantha created all of these videos during COVID, a lot of them, when we couldn't come together. And she wanted to make sure that everyone was still practicing. But these are people who've already learned the strategies and have been coached by speech language pathologists. While you can attempt to participate in what she's doing, if you're not getting the feedback from a speech pathologist to ensure that you're doing the strategies correctly, your efforts might not be as fruitful as they ought to be, because if you're doing it alone, you're not getting that feedback. And one of the things that Samantha had found, or her researchers have found, is with Parkinson's, the whole motivation, needing dopamine, awareness is also tends to tail off as well, not recognizing that the voice is really softening and being smaller. So the coach, the speech pathologist, is coaching and helping you differentiate what was your automatic speech and what is your intentional speech, and what do they both sound like, and really what does it feel like in your body, because they're two different sensations in your body when you're speaking with intent and when you're speaking automatically. So that's our feedback to you. What does that feel like? We want to talk about that so that when you're out without us anymore and you're out on your own and you might be going into these groups now, you want to make sure that I tell my clients, make sure that you're hearing my voice in the background, speak with intent, speak with intent. So that's really some of the things that I try to encourage and to really make sure that you can feel, okay, am I going into my automatic speech access or am I going to my intentional speech access? So those are the two things that we would be talking about in therapy.
We have our next question is, what is the difference between regular speech therapy versus the Speak Out program?
Yeah.
Well, speech therapy encompasses a lot of different things. When we cover the whole age span and lots of different disorder types, but when we're talking about Parkinson's, we really need a routine, regimented program of exercises to keep people doing the exercises daily. So that's where Speak Out came in, where Samantha Ellenderry, we keep talking about her in Parkinson Voice Project. She designed this program of exercises that that are supported in helping people with Parkinson's. So the program is really just a way to package everything together nicely. And so Myra and I use it. We've been using it since 2018, right?
I've been using 2018, yeah.
Yeah.
So prior to that, there was the LSVT loud, which I never got trained into doing. But I was telling Carl earlier today that anecdotally I've had clients or patients who have tried that and they were told to just speak loudly and they felt like they were shouting. And while they're using that strategy, and even before loud, and I know that loud is old, but even before loud, because Parkinson's voice is kind of a different, it affects our voice, but it affects overall our speech. And it's a motor speech disorder where we call it a hypokinetic dysarthria. So there's a little bit of this slow movement of the speech muscles, and because the movements are becoming smaller. And back in the day, before some of these strategies, I used to use, and I was trained to have my clients punch out their words. So I worked on, okay, telling my clients, all right, now I want you to punch out your words. And when they do that, they actually are speaking with intent because there's a lot more movement and more intentional punching out of their words. So that was kind of my go-to treatment method for improving speech. And I've also used some software that you're not going to be carrying around a software with you to visualize your speech every time, but there is software out there to give you some visual feedback. So some of these things I've abandoned, and when I found Speak Out, it was like, oh, this is it, because there is continuity of care for independent care and also coached care as well. So those are some of the differences that I had.
Yeah, and it's a great point, Myra, that the strategies, the approaches have kind of always been there. These techniques aren't necessarily new. It's kind of like old wine in new bottles. Speak Out is just it's a nice package to what we know works. It also provides a community of support, which I love. I mean, people from around the world are participating in Samantha's daily exercises online and chatting with each other online and motivating each other. So I love that aspect of it as well. It's really built a community.
Maybe if I can add to that, it it keeps you having to speak out of groups keeps you accountable and uh, uh, keeps you active and makes sure you stay on the program.
Yep. Keeps you accountable.
Although I do have an anecdotal. I did have a client, he was in his 50s, who had who was using DBS, deep brain stimulator. And it was interesting because he had to change the settings for speech, because he would change it back and forth between speech and walking. And I would have him change it to walking mode, because when he changed it to speech mode, speak out really didn't help, because the stimulator was on, stimulating his brain to produce speech and to stimulate some automatic speech. But when he turned it on to walking mode, his speech was quieter, the movements became smaller. So the strategies were much more effective that way. And so he was utilizing that technique and using more of the DBS for walking.
It's fascinating.
Yeah.
Our next question was about exercise. How much, what kind, and how often? So, Robert, do you mean voice exercises, or do you mean general physical exercise in your question? Oh,
Both. Yeah. So did you want to take that, Brett?
Sure. Yeah, so with the Speak Out program, there are generally 6 exercises that we go over. First are the may, me, my, mo, moo, just to work on getting your voice up and out. Then we hold out a strong ah. That's the second one. Then we will glide to expand, just kind of, be intentional with pitch range and pitch changes. Ah, ah, gliding like that. Then we will count, like we talked about in the slides, counting from 1 to 15, for example, and being really intentional with each number. Then we'll do a reading exercise where we might read a paragraph or multiple sentences, giving each word lots of intent. And then we'll do a conversational exercise where it might be a game activity or something to get people thinking some more while you're using intent. So those are the 6 exercises that we tend to use every day. For your daily practice, the recommendation is twice a day, that you would do these 6 exercises 2 times a day, morning and afternoon, if you wanted. And you do it every day. So that's sort of the exercise routine for speech.
And I know of some clients who do other exercises, like there's like boxing classes that they go to, some other movement exercises. They go to the gym religiously so that they can practice moving with intent. And some of them, I have one client right now who goes to boxing 3 times a week for a couple of hours. I thought, wow, that's exhausting for me to think of. That's a lot of energy. But yeah.
Well,
So
Okay.
Go ahead, Carl.
It's also encouraged if you're going to be going to dinner with friends or family or be on the phone to do your exercises at least quickly prior to your event, so you're more so you're more prepared for the occasion.
Yeah, what I notice is that when people exercise, they are doing a great job of speaking with intent, and then they can maintain that if they're thinking about it. But then as we start to not think about it, the intent will shift away, and then our voice might drop, or we're not as intentional. So every time we practice, we want to keep thinking about applying that to the next thing that we're going to do. So if you're about to speak on the phone or something, you could do the exercises first.
And a follow-up question was drooling. Can you talk a little bit about drooling and the exercises and how that all kind of fits together?
So drooling occurs as an accumulation of saliva in the oral cavity, and it just starts to and the awareness of it doesn't present itself. But doing more periodic swallowing, I don't know if we swallow we looked this up one time as a trivia, 900 times a day, not really knowing, even when we're sleeping, we're swallowing. So being more intentional with swallowing can decrease the accumulation of the saliva in your oral cavity. So if you really think about, okay, I'm going to swallow, every so often, because we do it unconsciously. We just do it because it's part of our automatic movements. And when we don't, and there is more of the awareness isn't there, you almost have to intentionally swallow so that you're reducing that accumulation.
Doctor recommended Botox.
To where?
In the mouth.
Yeah, I would be curious to see if you tried speak out and then started swallowing with intent. I would be curious to see if you were able to manage your secretions better that way and not need the Botox.
Yeah.
There's also the balance between dry mouth and drooling. I think, if I'm not mistaken, there are some topical things you can take for dry mouth. For drooling, I mean, isn't there something over the counter you can take for drooling?
I'm not aware of any things that you can use for drooling. That is, Brett?
Yeah, I'm not either. I know about dry mouth, but I'm not familiar with any products other than a rag for drooling.
Right. Yeah.
Maybe more liquid intake.
Yeah. Right, because that would get you swallowing. So it would encourage you to move the secretions more.
The other option was chewing gum.
Yeah, same idea.
Yep.
One more question that we had in the chat was, can folks who don't have Parkinson's participate in the Voice Project if they want to improve their speech?
My recommendation there is if you're having speech problems, but you don't have Parkinson's, you should seek out either a speech therapist or talk to your doctor about the speech problems you're having so that your treatment can be specific to the issues that you're having. Now, the Parkinson Voice Project Speak Out program can apply to other disorders that are similar to Parkinson's, but I wouldn't necessarily use Speak Out kind of on your own. I would want to know exactly what the issue is that you're having, and then have treatment that is appropriate for that.
Excellent.
Right. There hasn't been a study that Speak Out is effective for other disorders that I am aware of. I've only read studies that Speak Out has been effective for people with Parkinson's.
Did anybody have a question that they weren't able to put in the chat if they wanted to raise their hand or unmute themselves? I just didn't want to miss anybody's opportunity to ask a question.
I was curious. Have you seen any increase in fluency for stutterers?
Oh, for stutterers. Not for Speak Out. I've not tried it. We do have a fluency client who's a college student. We have not tried Speak Out with them because it's a completely different protocol of therapy techniques to use with stutterers.
We just had another question in the chat. If you've taken Speak Out with a speech pathologist, could you join one of, I'm guessing the question, Caroline, you mean join one of the Speak Out groups? Is that what you're saying?
Yeah, or would you have to repeat the Speak Out program with the speech pathologist?
At our program, we will take members into our groups if you've already done Speak Out somewhere else. So
Okay.
you can just join our weekly group sessions. We might have a refresher with you just to, have a one-off sort of get to know you session, but then we'll put you into the group right away.
Okay, my husband's in a boxing class with about 90 Parkinson's patients.
Whoa.
So yeah, I didn't find out about this until yesterday. So I tagged the neurological PT person who leads. He has his own practice, but he also has these, multiple groups that meet with him.
Yeah.
So I'm gonna put out the YouTube video about this because somebody actually talked to me at our Christmas party on Saturday about this. And although I have their email address, I didn't feel like I could use it to do this. I thought it should come from Scott. So is that going to be problematic if I throw that out to the group?
No, we welcome it.
Okay. All right.
And that's what we love about the network in Virginia.
Yeah.
Yay.
It was
Yeah.
yesterday. I didn't find out about it till late. And I tagged Kelly, his wife, who runs the PT therapy center. But that was pretty late to really get the information out about this. So we'll see what happens.
Wonderful.
Yeah. Just also full disclosure, I'm also licensed in Arizona, so I've kept my license there after being there for 35 years. And I'm also licensed in California because I've had students that were part of our caseload who are going home to California and needed some continuity of care. So I pay for my license there as well. So I currently have clients from California and Arizona and Virginia that we see through our clinic virtually.
Jim, yeah, I saw your hand go up. Do you
Yeah,
have
I
a
had a
question?
question about what is Parkinson's that they mentioned. What site? How do I get that?
Yeah, it's called Parkinson. I could put it in the chat. It's Parkinson Voice Project.
.org. Yeah. So that's the website.
Okay, thank you.
Sure.
And I do boxing, by the way. Twice a week I do boxing. So I found two different exercise programs that didn't fit me quite as well. I did Tai Chi, and the boxing one seems to be really good for me. So
recommend Orange Theory as well.
Orange Theory.
Yeah. It's a high speed, intensive treadmill, rowing, and dumbbell type from platform to platform. It's timed because,
Is that the interval training program where it's really high intensity for a short period of time?
What's the other one you mentioned?
Robert, the Orange Theory, is that the high intensity?
Yes.
Okay. Yeah.
Yeah, it depends where you live. There's so many programs across the state, from boxing programs to rock climbing, upending Parkinson's is in different parts of Virginia. There's, of course, as you mentioned, Robert, Tai Chi,
Ping pong,
YMCA. We have
Pedaling for Parkinson's.
Pedaling for Parkinson's. Down in the Richmond area, there's various programs there through the YMCA and Power Over Parkinson's. POP, they have excellent resources down in the Virginia or around Richmond, Metro Richmond. If you ever have a question about any of that, we do have a phone number here at Parkinson Social Network, 571-286-5000. If we don't have a program that we know about, we can put you in touch with other Parkinson's resources in the state. And that also kind of includes the DC metro area. There's a lot. We're very fortunate in this area, but we're even more fortunate now. We have these virtual offerings through University of Utah and Shenandoah University. That makes a world of difference. And Caroline, you're more than welcome to have the coaches contact Parkinson Social Network if they have more questions, and we'll get you to the right place as well. But please share early and often.
And then again after that.
Yes, exactly. I would love for Brett and Myra to say we've been inundated, but we're helping everyone. That would be awesome.
It has been great to get the wave of requests. So it's been pretty flattering too. So
what is the next step for us? Sorry.
Yes, you're right, Robert. Exactly. Well, and whether it's Big and Loud or LSVT or Speak Out, the most important part, in my opinion, as a care partner is that somebody has help available to them, even if you don't think that you're quite ready for it. We want you to be able to maintain what you have for the long haul with Parkinson's, because speech and swallowing is so vitally important. I think sometimes we don't talk nearly enough about the communication aspect, and it has a profound impact, I think, on the person with Parkinson's, but the care partner, caregivers, family members, etc. And we want to make sure we beat the drum loudly so everybody has the opportunity to keep their communication.
Yeah.
That's my soapbox. I just mounted. Anybody else? Lauren, did you have a question? I saw your camera just come on. Did you want to say something?
No, I just wanted to claim my seat on this Zoom, and say I'm happy to be here. I'm out, I'm in California, and I work with Pediactive and provide, a singing weekly group that includes speech pathology for people living with Parkinson's and people caring for people living with Parkinson's. So I thought it would be really fun to meet all of you today.
Thanks for joining us.
Yes, come back anytime.
Thank you. And thank you for what you do for the community. That's awesome. Do you offer anything virtually?
It's all virtual. It's all
Oh, that would be great if you can find a way. Send us an email at board@parkinsonsocialnetwork.org.
Is that on your website? Is that all? Is that a list somewhere? Great. For example, on this invitation, is that there?
We can add it. We send out most weeks we send out a alert kind of talking about the programs that we have for the month, and we do a monthly newsletter at the beginning of the month. But we do also have a small reference page, so we could put that on there as well.
Have you a YouTube channel?
Yep, we have YouTube as
You
well.
have a YouTube channel. Fabulous.
Yes.
Which today's video will in the near future be on our YouTube channel. We have a lot of recent videos, and of course, everything we do, we welcome everyone. All our programs are open to anyone. They're all, of course, free. And we're always trying to spread the word. So that would be great.
Go ahead,
Angela?
Rowan. Yeah, go ahead.
I have to say, as a former caregiver, I wish I had known about this particular program years ago when my husband was still dealing with Parkinson's. It would have saved many arguments about the quality of my hearing and how soon I was going to get my hearing tested, because it's your problem. I speak just fine. And this looks to be a program that anyone can participate in without feeling like they're, what should I say, self-conscious about their limitations, or self-conscious about making loud noises that kind of set them apart and feeling strange, and would make it so much better, because we found that as his speech got quieter, people didn't talk to him because they couldn't understand him. So they would talk to me and ask me questions about him, which would make him kind of irritated. Why don't they talk to me? And anybody who doesn't take advantage of this program looks to be missing out on a real life changer that makes everything much easier.
Excellent points.
That's my soapbox.
Thanks, Arlene.
Well, you get people that offer you your seat on the metro, look at you like you were homeless. I've seen a lot of that.
Well, I was having been on the board for Parkinson Voice Project for over 20 years. I've seen it change a lot of lives, and this is an important. This is a very important point in the project. This is a life changing time for the project, and I'm so glad you guys are taking this on for the state in D.C. It's going to change a lot of people's lives. Thank you for doing this.
You're welcome.
Yeah,
My
thank
pleasure.
you.